Hello everyone and welcome to this audio podcast. This audio podcast is part of a Papillae Sirocco series. This audio podcast is part of a Labostix Communicado, an audio podcast as part of a Squadron Kamikaze, an audio podcast as part of a Storm Labostix production. This audio podcast, in this audio podcast, a sort of a summary, if you like, in around this peer review works. So in around the clinical medicine aspects around HUS, that peds young people can have as part of the symptomologies a sort of a bloody diarrhea, which is still can be and is perhaps one of the most important sort of symptomologies to be aware of in young patients and young recipients in young patients and young patients with HUS. There's renal function over time must be monitored. Hemolytic parameters may be differently altered in the various conditions, thus helping in a differential diagnosis and coagulation, which also must be monitored. Now, in a previous audio podcast, just to iterate again, that in a previous audio podcast, there was a sort of a basis in around the coagulation aspects of HUS, and so the coagulation investigations are part of the sort of routine investigations in peds with HUS, and so the coagulation throughout a patient's lifetime with HUS, coagulation investigations are generally pertinent. There's also investigation referred to as the lactate dehydrogenase or LDH, and it can be useful in elevating in evaluating the response to treatment or specific treatments as its level decreases along with the reduction of the hemolytic rate. And then polynucleosis is also a factor of poor prognosis. In around the clinical anatomy and histopathology, the glomerulus shows a hyalinization, a thickened and sometimes split capillary walls due to endothelial swelling. The tubules show sort of atrophied and contains hyalinized casts. The interstitium show sort of a fibrosis or fibrose with lymphocytic infiltration. The vessels show arterial and arteriolosclerosis, intimal hyperplasia, and fibrinoid necrosis with large deposits of fibrin-related materials in the capillary lumen. There are the clinical anatomy and histopathology generally show an occlusion around where occlusion and thrombi throughout blood vessels throughout blood vessels, where blood vessels again in around for example the arterial afferent arterioles, the glomeruli, and sort of throughout the histology or histopathology of the renal sort of renal or kidney sort of blood vessels. That draws this audio podcast to a close. The audio podcast, this audio podcast series will have some sort of a list of references that listeners can sort of check out in relating to similar works, and the audio podcast series will and should be on across various social media as part of the general series. This has been an audio podcast as part of the Papillae Sirocco series, an audio podcast as part of a Labostix Communicado, an audio podcast as part of a Squadron Kamikaze, an audio podcast as part of a Storm Labostix production.